it's very common for people to go on Google and YouTube and type in stretches for lower back pain, and it doesn't work most of the time. And I could tell you right now that if you were to type in stretches for lower back pain, you're going to get the same standard stretches. Pull your knees to your chest, stretch the piriformis. Everybody's in love with stretching the piriformis for some reason. And so what ends up happening is lower back pain is a diagnosis similar to tooth pain. If you went to a dentist and said, I have pain in my tooth, and they said, well, you have toothalgia, it's really kind of silly because it doesn't give you any description of why the person's having tooth pain. And so you wouldn't have a one-size-fits-all type of treatment for tooth pain because it wouldn't work on a majority of the diagnoses. So the thing is that for the lower back, there's various types of reasons a person can have low back pain. There's many forms of disc problems, such as internal disc derangements. There's different types of herniated discs, and there's disc degeneration. And for the most part, pulling your knees to your chest and stretching only really works when the spine is degenerated, if that. But the herniated disc, and especially the internal disc derangement, boy, if you have those and you try to stretch them, you're going to make yourself worse. So generally, you don't want to do that. Facet syndrome is a common cause of lower back pain, and that's a case where stretching might help. Sacroiliac joint dysfunctions, boy, stretching can either make you worse or better. It really depends on the sacroiliac joint. And then if you have a piriformis syndrome, then certainly stretching the piriformis, it definitely helps and it feels good. Some cases of lower back pain are actually caused by hip problems, and the actual pain is referred up into the lower back. And in those particular cases, stretching it's just simply a waste of time. So the problem is, Google and YouTube really doesn't know your diagnosis. So the thing is that when you type these things in to those websites, it really is a hit and miss type of situation. I think it's better to have a true, accurate diagnosis first, and then you can decide if stretches are going to benefit that.